morning, good afternoon, good evening, depending on what time you're going to see this recording. I'm so excited today, so thrilled to speak to one of my role models in this world for sickle cell disease. I've got Dame Elizabeth joining me all the way from London to talk about her experience caring for people living with sickle cell disease and just sickle cell disease in general in the UK and around the world. So firstly, how are you, Dame Elizabeth? Thank you so much for joining me.
Thank you. I'm not too bad. Thank you very much. You're all right?
Yes, I'm fine. Just a bit cold here. How is the weather in London today?
It's cold, but it's sunny, so that's fine by me.
Well, I'm excited to have you virtually in Australia, Melbourne. Hopefully one day you get to visit, to see you face to face. To begin with, I just wanted to sort of set the scene and talk about your upbringing in terms of, knowing about sickle cell disease. We are going to talk about sickle cell disease, your career and your book, and just general, sickle cell disease globally, whatever you can share with us. So to begin with, just tell me a little bit about yourself, just a brief history about yourself.
So my background is I'm half Irish, half Nigerian, and I was born in Birmingham, England, and my parents weren't married, and my mother, because of some difficulties in those days, because I'm now 74, so we have to think about the fact that this was just after the Second World War. So I actually spent the first 9 years of my life in a children's home, but my mother constantly visited, and I then lived with her and my stepfather. That didn't work out. You have to think about racism in this country in those days in particular. And then I had a happy adolescence with my maternal grandparents in the north of England. And I always wanted to be a nurse. So I did my nurse training in London, 1965 to 1968. And then a few years later, I studied health visiting, and I worked as a health visitor in London for 3 years in the early 70s, and then became a community nurse tutor in London, and then in 1979 became the first sickle cell nurse counsellor in the UK, in Brent, with a wonderful haematologist called Dr. Misha Brozovic. And I did that work for 10 years before I went into academia, but I always maintained an interest in sickle cell disease. And I became a professor of nursing in, trying to remember, the late 1990s, and retired in 2007 when I was 60.
Well, that's a brief, nice history, and which I've read. So just amazing to know a bit about you. So what prompted you to, if I go back a few steps, to study nursing?
It was when I was living in the children's home, and I had very bad eczema, and there was a particular nun who was the only nun that could change my dressings without causing me any pain. And I discovered she was something called a nurse as well. And so I decided that's what I wanted to be, and I never regretted that decision. Yes.
Wow, that's a very good story. I mean, I know we have role models, and look how you turned out to be like a professor and everything in nursing. That's very interesting. So talking about sickle cell disease, so you said you had opened up a center in the 1970s about sickle cell disease. Did you know anything growing up, anything at all about sickle cell disease before you started that center?
No, nothing. My first contact that I remember with the condition was when I was a health visitor. This would be about 1971, 72. And probably 1971. And I visited a mom who had a 9-year-old son with the illness, and he was lying on the couch, not in severe discomfort, but you could see he wasn't that comfortable. He'd just been discharged from hospital. His mother was actually fairly happy with the treatment that he had in the hospital. I think she got on well with the pediatrician. But she wanted to find out so much more about how she could help her son in the home, at school, in the community. And she wasn't really getting the answers, the information that she wanted. And so I got on with her very well. And she suddenly started asking me a lot of questions. And I felt very embarrassed because I had not had any lecture on sickle cell at all. So I wasn't able to help her. And I vowed that I would try and find out more, but it was very difficult in those days. And so I was very frustrated, and I was very angry that as a nurse and as a Black nurse, and at that time I didn't know I had a relative with the condition, but I just felt, why is this an illness that we haven't been taught about? And I was also interested in politics with a small p, as a Black woman, a Black nurse, a Black health worker. And I just felt that this was a terrible example of health inequalities, that I knew about other conditions, which I should know about, but I should also have known about sickle cell disease, particularly, particularly as I trained as a nurse in London. And looking back, I realized that there would have been children with the illness. As I said, they wouldn't have come to my hospital, but even so, why wasn't I taught about it? And why wasn't I taught about it as a health visitor? So yeah, I was really angry about that gap in nursing education.
That's interesting. That's in the 70s, because I know one of the eldest people living with sickle cell disease here in Australia, they are in their 70s. And if we are talking about that period in the late 1970s, and with the population of the Black people in the UK, there were people living with sickle cell disease. And to know that, comparing that period to now, where even up to now, it's not taught as much in the universities. So there still needs to be, a lot to be done.
Yes, and that's you're quite right, Agnes, of course, and certainly in this country, have to recommend the activities of Mr. John James, OBE, who is the chief exec of the Sickle Cell Society in this country, and this is an area that he's working with some of the nurse education authorities, because it isn't automatic still that a student nurse would get information. It's better, but it's not. We want to make sure that any student, having completed their nurse education program, and it's in the university now, of course, and linked with the clinical placements in hospitals, etc., they will have had information about sickle cell disease during those 3 years. That every student nurse should receive it. And the difficulty at the moment is it's very ad hoc. It depends on the nurse tutor. It depends. It's pot luck as to whether a nurse will feel competent that they can care for a patient with sickle cell disease once they qualify, and that's not satisfactory at all.
And that's the trend globally. I've had the fortunate thing to speak to a lot of advocates around the world. That's happening even up to now. It's not uncommon in Australia here, where you take a child to ED and the doctors will have no idea whatsoever. So my experience, for me, I've got a sickle cell trait. We had 3 healthy children and nothing at all to know about sickle cell disease. I had people in the community that I knew that sickle cell disease, but being somebody I came from working in the bank, I had no science background. So it's not something that I thought I could Google and learn about it. And to be told that our daughter, our 4th child, had sickle cell disease, that it's a genetic condition, that I had no idea that I could be a carrier, it was a shock. So for years, we were just in this bubble trying to find out as much information as we can here in Australia. And some of the things we're talking about, it's still the same, even up to now. It's still the same here in terms of, the migration patterns have changed. We are like in one global, world, and these things should be well known in all different parts of the world. So in terms of yourself now, after knowing all this and obviously doing a bit of learning about sickle cell disease, did you take a deliberate move to get tested, just, that maybe you may carry the sickle cell trait?
Yes, certainly. Yes. And I found that I had the usual hemoglobin type. By this time I'd found my father, because I didn't grow up with my father. And I found that I had a cousin with sickle cell anemia who was actually living in England. And he did I think very well. He lived into his 60s and he had a decent quality of life. But it brought it home that it was personal as well, that it was in the family. But no, I certainly did get tested and found that I had the usual hemoglobin type, hemoglobin AA.
Now, going back to 1979, when you established the first ever, nurse-led sickle cell and thalassaemia screening center, how did that change the sickle cell atmosphere in the particular area where you were, and even just the involvement of the local authorities? How did that change? Did that drive more research or more people to come out?
Well, it didn't come out of the blue. I had been working as a research fellow with Dr. Brozovic, and so had been with one of the projects was to find out how many individuals there were known to the hospital. So I was going through the medical data, the hospital records, the hospital activity analysis, it was called. And in fact, that was the first publication I did with Dr. Brozovic. It was published in 1981, and it was looking at the group of patients that were identified. And we found that we wrote about 70 of these individuals. We didn't obviously name any of them, but we described the characteristics and the ages and the frequency with which they came into hospital, etc. So I'd been doing research before I became the first sickle cell nurse specialist. And the reason that came about was that I'd been going to America to visit my Nigerian relatives. And also I realized that that's where I could find out much more about sickle cell disease. There'd been so much more activity in America, partly due to the civil rights era. And also there were health professionals who were really campaigning as well. And as a result, the Sickle Cell Control Act was passed in the United States in 1971, I think. And as a result of that, there was the development of a network of comprehensive sickle cell centers, which incorporated obviously clinical care, teaching, screening, research. They're wonderful. And one of them, well, there was one in Los Angeles and there was one in San Francisco. So I was able to visit those, and also even before that, the American Sickle Cell Foundation, because that's based in Los Angeles, and they were so helpful. They were a bit surprised to hear me talking about sickle cell disease in England, to be very honest, but they bent over backwards and provided with me, getting me onto a course in San Francisco, a short course, a fantastic course on counselling for the hemoglobinopathies, counselling for sickle cell disease and thalassaemia. That's genetic counselling, but also a bit of general counselling. And that's where I met a lot of sickle cell nurse specialists who were on the course or were teaching. And a lot of them were African American. So I was able to, they took me under their wing as well. And I came back and told Dr. Brozovic, look, nurses can play a part, as I've seen in America. Up until that point, I had only thought it was pediatricians and hematologists that looked after children and adults. And some of them specialized a bit in the condition as well. So when I described the role of the nurses that I had come across, Dr. Brozovic thought it was a fantastic idea and found the funding for me to set up the center. So that's how it came about.
That's interesting. The things that you went through for people to be shocked that you have sickle cell, that's the shock that people have when the last time I attended ASCAT in 2019, we did a poster just to show people that, we also have sickle cell, and obviously with the migration patterns, this is what's happening. People are shocked, even up to now. People even comment on Twitter, like, we didn't know that the sickle cell in Australia. I'm like, well, there's people and there's Africans like me. And so right now we are talking about 1,000 people. We don't have an accurate database up to now. So it's just an estimate of how many people are affected. So it's interesting to see what you've gone through and where like the Sickle Cell Society UK has been up to now. So yeah. So with the healthcare system is one thing, but with the community, what sort of support or what sort of, the people, did they embrace that center? Because one thing that we've seen here in Australia, we are very, very like active in all the states, the 5 states where we have at least maybe over 100 or so per state patients. The community is not so involved. I think there's also maybe a bit of maybe for lack of a better word, stigma to coming out to speaking about having the condition. Did that change when you opened that center? Did people embrace the idea?
Well, it was actually changing before the center opened. My background interest, the way I operate, is actually called community development. I mean, I didn't use that. I didn't know about that term, but somebody told me, look, the way you're operating, Elizabeth, is community development. In other words, I always had a foot in the community and a foot in the health service, even though I'm employed by the health service. But it's, to me, was common sense that for an issue that the country itself, the public health system, the government did not have sickle cell disease as a significant issue on the National Health Service agenda, well, it's obvious then that if health professionals don't learn about this condition, or very few of them, why should the community know more than the health professionals? I mean, so one of the areas that we got involved with was at the same time was setting up the Sickle Cell Society. And that was, they were established in 1979, but there'd been a support group, a local support group leading up to that a few years before. And several of us who got educated about sickle cell, and I'll talk about myself, but there were others. One of the things I did like teaching a lot, would be to talk to groups, faith groups, women's groups, Black community groups, nurses as well, I mean, health professionals, about sickle cell disease. And don't forget, I had now this supply of educational material given to me free of charge in America. So it was the Sickle Cell Society that I worked through, showing films, slides in those days, all over the country. I mean, there was an interest, and you're quite right, Agnes, that there was stigma, and there still is a little bit of stigma, but there was a lot of stigma. And one of the questions that was constantly asked was, by people in the Black community, and even by families affected by the condition, how come we've never heard about this condition? And there was a sort of feeling, of a minority of people, that this was a conspiracy against the Black community. How come we never heard of it back in the Caribbean or wherever, or in this country where they were born, some of them? How come we've never heard about it? And we said, well, we feel it's been a neglected issue. And when you put it in those terms, people actually started to, okay, And then the other aspect that helped enormously was the media, particularly the local media and the Black media, the newspapers, the radio stations. They were very keen. They're always looking for speakers. I mean, come on. So they start to get word of this new, as far as they're concerned, new condition, and they invite you. And then where I noticed the biggest change over the years was, initially, it was very difficult for individuals who had the condition to have the courage, and I think it is courage, to speak openly, because they didn't want their friends and their neighbours and even members of their family to know that they had it, because oftentimes they were brought up to be told, don't discuss your illness with people, and they themselves were frightened if they discussed it, would it affect their job prospects? Would it affect their friendships? Would it affect their relationships? You know, when should they tell their girlfriend, boyfriend, partner, whatever, that they've actually got this illness? This is a genetic condition, as we know. What would be the implications for their children? And how would their partner react to that? So there was all sorts of things going on, which was, as far as I'm concerned, totally understandable. I think why we got on well was, because we've been told this, we showed respect. We didn't look down on people. We didn't give the impression we knew best. We knew more than they did. This is what you should do. Even with testing, people had to understand why we were suggesting and it's suggesting as well, why we're suggesting that they get tested. And also that whatever happened in terms of their results, whatever reproductive choices they made, they were their choices, but we were saying, be informed about those choices, you know, because and gradually we built up a group of individuals who were prepared to talk openly about the condition. So we would have parents talking about how, you know, in like your experience, Agnes, we would have adults talking about the impact of the illness on themselves. We even had teenagers talk, you know, willing to talk. And that shifted the issue considerably, that in a sense, particularly in the Black community, they started to get angry as to why there wasn't being more done about sickle cell disease. Once people have information, on the whole, they come on board. Not everybody will, but they were in the minority, the people who didn't want to know. And no, that's their wish. I think you can compare it actually to the COVID-19 pandemic in terms of some people don't want to talk about it. They don't want to have their vaccination. And if they've been provided with the information, well, that's their choice, you know, whether we like it or not, but that's their choice. You know, we made it clear that there was no coercion in respect to sickle cell screening. And also that our attitude was, it's up to the couple to decide what they do with that information. We're not dictating to them, oh, well, you've both got sickle cell trait, you should do this. No. We're saying, if you want to know whether you're at risk of having a child with the illness, this is the only way you can find out. We will provide information before you have your blood test, once we know the results. And then if you want any further information and support, that's what I can offer. So I think when they realized I was actually, somebody said, well, you're quite laid back about this, Elizabeth. You're not telling me. I said, I'm giving you the information for you to decide. I said, even if I did dictate to you what to do, would you do it? I mean, I had a sense of humor and I would use that humor, and they look at me like, oh, she's not a typical bossy. Well, I am quite bossy at times, Agnes, but they liked the fact that I was respecting, this was to do with their reproductive decision-making. It's a very sensitive area in any community, and particularly in the Black community, where we've got historic negative experiences in certain communities by certain authorities as to how they view the Black community, the negative stereotyping that has happened and still happens by certain people towards the Black community. And we have to accept that racism has hindered a lot of development that we would have liked to have seen. But we just worked, if we can work together, then that does help. So it was very much a community activity. It wasn't one individual. And there were a significant number of people who didn't have sickle cell in their family, who wished to make a donation, who wished to be a volunteer for the charity, who wished to support families with the condition. So I would hear generalizations both within the Black community and outside of the Black community that I would just knock on the head. I said, well, no, that's not what I've come across. Maybe a few people, but not generally. And I think because you're prepared to stand up and say, no, that's not actually right. And, you know, and also when I was doing talks a lot in the community and elsewhere, but particularly in the community, if I was challenged, I wouldn't take it personally. Initially, I thought, oh, and then you start to realize that they're angry generally. Then don't take it personally. And then also what would happen in a meeting, for example, if somebody was really having a go, a member of the audience would just say, look, sister, brothers, just stop this, Elizabeth's trying to help, or whoever it was. And I gradually realized, just be patient. Obviously, if I was challenged unfairly, I would stand up for myself. Don't get me wrong. But I realized that for many people, this was the first time they were getting a significant amount of information about this illness. And it was quite overwhelming. And for some people, it was quite scary. And they just didn't know what to do.
When I came I've been reading about sickle cell. For me, our family, it took for me to have the courage, 5 years, to have the courage to come out and speak about it openly. And what worked for me, to me, my disadvantage was I'm one of those people that just reacted badly with the sickle cell trait. I was in hospital, ending up in intensive care unit when I was pregnant with my daughter. So already, because I was sick, I was thin, doctors didn't know what was wrong with me, and people thought that HIV, AIDS. So there was that already stigma attached to my getting sick and my daughter. So I had to overcome that to just say, I'm still alive, I'm still here. I didn't have AIDS. And then now to be told that my daughter had sickle cell, I was a bit depressed a few years. And so I started reading. I put all my thoughts and my mind into reading, changing careers from a corporate world into studying nursing. And after now, I'd learned so much, but I still had the courage. I just couldn't have the courage to come out. And slowly I started. So I started with similar opening a support group online, until one day I just thought, you know what, it's time. Then I started posting things on social media to tell people that, by the way, this is what's happening with our family. So I had known about sickle cell disease reading, but it hit me when I came to ASCAT. In my head, I'm like, seriously, this condition is here to wipe the Black race. Because the talks I had, the education I had, and how it's just affecting, the Black people, and how there's not so much research, not so much funding and studies in this condition. I actually shed a tear just to say this is really huge. I didn't know the magnitude of the people affected by sickle cell disease until I saw those education sessions the few days that I was in London. So it's still happening in terms of people embracing, talking, and getting that informed decision. It's still happening. So not so much things have changed there, then and now.
Well, there's certainly much more knowledge, and whilst we're saying there's not enough, compared to the late 70s, I can see a huge difference. It's very rare that I come across a nurse. I'm talking about in those areas where there is a lot of sickle cell disease, not necessarily in areas where there isn't. More nurses know about the illness. Now, I wouldn't say that they necessarily knew enough, of course not, as we've talked about. But there is a greater awareness of the condition. Nationally, I think, is where the biggest developments have come in the National Health Service. And the best example I can give is the antenatal and newborn screening, particularly the newborn screening, where in the 2000s, I don't remember the date, I'm afraid, but a properly funded newborn screening and antenatal screening program was established in this country. And what that meant was that every baby, regardless of ethnic origin, can be screened 6-7 days after birth. That's huge. That was revolutionary in my mind, because part of the bigger problem prior to that was that babies literally slipped through the net because either the midwives didn't understand. It was selective screening, and there was this idea, you had to be Black to have the illness, and the blacker you were, the more likely you were to have all this. There wasn't the awareness that you could be white and blue-eyed, blonde hair and could inherit the illness. There was no understanding about the genetics of the condition and the fact that it can affect everybody, even though it affects certain people in higher numbers. Yes. So the fact that what was called a universal newborn screening was implemented was huge. And it did mean that we wouldn't have this situation where you had to wait for the child to develop symptoms and then, hope that the family doctor or the accident and emergency unit would recognize, as you know, the variety of presenting symptoms that there could be. And so if it was, for example, painful swellings of the hands and fingers and toes, that historically was misdiagnosed sometimes as child abuse. I mean, it's just awful, but that's what the situation was. So there's, if you, with the introduction of routine universal newborn screening, before a baby gets the symptoms, you diagnose the baby well before 6 months of age, when we know probably most babies might start to get symptoms then. You're diagnosing them literally before they're a month old. So this is good healthcare practice. And because you've also got universal antenatal screening, so more couples are aware, hopefully early in pregnancy, that they then discover that they're at risk of having a baby with the illness. Obviously, people would prefer to know before they even got pregnant, so that they could make the reproductive choices that they wish to make. But so that side is not what we call preconceptional screening, isn't as well structured as it could be. But progress has been made in terms of antenatal screening and neonatal newborn screening. That's huge strides. In addition, the care of patients has been reorganized so that there's regional structures and regional centers of excellence in this country. When I say regional, London, of course, the large number of cases are in London and Birmingham. So in London, there's several centres, quite a few, and those centres are expected to act as hubs and provide information and support and care for the hospitals in their area, if you like, so that to avoid what we certainly were used to seeing, that hospitals and healthcare professionals were quite isolated in areas where there weren't significant number of cases. So those hospitals now have expert care centres, if you like, that they can refer to, that they can get advice from and get support from. Now, I obviously COVID-19 has impacted the world, never mind the NHS. So I have to be honest, Agnes, and I'm retired, so I'm not in practice. So you would need to, if you wanted to discuss that further, I think you'd need to go to the Sickle Cell Society or, contact some of the specialist healthcare practitioners in the National Health Service. I'm not up to date with that, to be quite honest.
I had Dr. Titikas, who's a hematologist in one of the, I think he's at an NHS a few months ago. We had a bit of a discussion of the sickle cell in the UK at the moment. So, but it just helps, like where we've come from and what you've seen. Yeah. There is a huge improvement, and that's what we're trying to achieve here as well. Unfortunately, we don't have newborn screening. Prenatal screening is not mandatory. It's which hospital you go to, which gynecologist, if you say so, you see who can recommend that, but it's not in the guidelines to do that. So we are still a bit far away. Hopefully we improve that as well. I'm mindful of you sitting down for a long time. We'll be finished soon. Just one or two questions before we finish. In terms of, yourself again, we are living in an era where sickle cell disease has been recognized globally. You've also been recognized for your work by different organizations, including the Queen. Did that highlight, again, just amplify, the cause for sickle cell in the UK?
Oh gosh, yes, because it creates publicity, doesn't it? And I was invited to talk about my life and obviously sickle cell as well. So it provided a platform to raise the profile even further of sickle cell disease, and also for me to point to other people who could talk more about the current situation. And I am a patron, one of the patrons of the UK Sickle Cell Society. So it's great to be able to say, well, there is this charity. I would suggest you go onto their website, contact them. And that's very helpful to be able to raise the profile of the Sickle Cell Society and encourage people to support that charity as well.
And one of the things that you've done, to do this, I want to share a screen. You've written a memoir about all this, and I will get the book. I'll show you that. I'm waiting for it to come, and then I'll show you. I have to have it in my hand. I don't want to buy anything until I get the hard book in my hands. I'll show you. So I just want to show the screen to people who will be watching. You've written a memoir about all this. We can read more about your story. This is on your website. I went snooping.
Oh, good for you.
This is on your website. You've written a memoir, Dreams from My Mother. Tell me a bit about this book and what prompted you to write it, and why did you wait so long to write this book? I'll leave it on the screen for now.
Well, thank you very much. Well, initially, I did actually self-publish my memoirs about 5 years ago, but a publisher then came, this Orion publisher, Seven Dials, and so I was able to update it and revise it. And I had been urged by many people to write about my life because, particularly when they heard the difficult start I had as a child, mixed race, parents that weren't married, living in a children's home for the first part, as I've said. People then started to say, well, how come you've done so well in your life? You need to share your experiences, because that's not often the narrative about mixed race, illegitimate children, as they were called. How did you manage to achieve? What helped you share? So that was the trigger for writing my memoirs, and the feedback has been fantastic. And it's also the Dreams from My Mother is also an audio book as well, which I hadn't done before, because I know that some people prefer to listen to an audio book rather than read paperback, and it's obviously also on Kindle. So it provided me with the opportunity to literally go step by step from my early life right through till, well, as I said, I was able to update it to even touch upon the COVID pandemic. So
it's on your website. People can find it on Amazon, right? Kindle and audio. Or can we find the paperback in a store, anywhere in the stores in London?
Yes, it's available at any bookstore. You can ask for them to order it. It's very easy to get hold of. Yes, thanks.
I'll definitely be getting one for myself. So just winding up, I think we have talked about, I'm just trying to compare the way Australia is and the UK. What advice can you give our young organization? You've only been around officially for 3 years. What advice can you give Australian sickle cell advocacy, how we can, do our work?
I think, honestly, Agnes, I think you're doing a lot of the things you should be doing. I mean, the first thing is that you're networking internationally. That was so important for us in the 70s. We were linking in particular with the United States, because they had so much to teach us. And there are many, as you are already aware, but there are many more countries that have come on board and have national associations. And also, it is a bit easier because of the web, that you can access resources so much more easily and share resources and share your experiences, because, as you've said, Australia would not necessarily come to mind in people's minds in respect to sickle cell disease. So you are taking this responsibility quite seriously. I can see that in saying, actually, Australia does have sickle cell disease. Then you've got to, from what you've learned and the support that you get internationally, the big priority is obviously in your own country. And it's important that you have the political influencers aware of what you're doing, and that you're able to provide them with the information, because nothing can happen really significantly without the politicians' support. And you also need to have support from within the Australian Health Service, the significant policy makers who may well need to be educated, may well need to understand what the issues are and why they should be supporting whatever recommendations you are making. And obviously you are, I'm pretty sure you are making recommendations. And the best way to do it, and you're already doing this, I don't think I have to teach you anything, I must, to be quite honest, is ensuring.
I need to learn a lot.
Well, it's ensuring that the voice of those affected is the loudest that is heard. It's their voices that need to be center stage. And so the work that you have in the fact that you're sharing very honestly your own journey and how you were stigmatized, how you were frightened, how you didn't want to necessarily publicize, that gives confidence to those that are still in that situation. And then those that who are prepared to talk, give them the platforms, because the strongest force ever, and still is to hear the experiences of those affected by the condition. And what is it that they are happy about within the health service? What is it they're okay about with their care, that they're prepared to say, well, look, this went well, I'm happy with this, in addition to what are the gaps? Where have things gone wrong? Where could things improve? What suggestions would they have? But for them to share their experiences, and the more people you have who are prepared to do it, the less likely is that an individual gets burnt out because they're constantly sharing their own story. There's nothing more powerful for an audience of health professionals, politicians, journalists, than to hear the story of those affected. I quickly learnt, the need for people like myself when I was involved to step back, but to what my role was as somebody not affected by the condition was to enable those who are affected by the condition to have the confidence, the support, the information for them to share whatever they wish to share about their own experience. Because the number of times I have watched the faces of people listening for the first time, and the look of horror and empathy, a significant number are then driven to try and do something. And then before they'd heard these experiences, well, they didn't really understand it. And even if they'd heard about it, it's different to reading about something than to listening to somebody talking about their experience. So I've never found that to fail, ever. So initially, our problem was finding enough people who felt confident enough to go onto the radio or television or have the public spotlight on them, because it is tough. So that they need support in how to do that if they wish to do that, and also the support after they've spoken, because it can be quite emotional for them to discuss difficult issues that they've come across, particularly if they're talking about bereavement of a family member or something. They need backup support for that. So it's important to get journalists on board. I think you call them influencers today. If there's anybody who is well known, who has got the condition, or is a parent of a child with a condition, who is prepared, like you've done, Agnes, who's prepared to come on board with you, we know that, you know, people watching the television or listening to the radio sit up. Really? I didn't know. Oh, okay. You know, I admire that person. I didn't know they had this illness in the family. I will now listen to what they have to say. And also, of course, working very closely with health professionals, because you've got to work in partnership with them, however bad the issues are. It's no good.
Definitely. Like we are so lucky. Like every conference that I've attended, I always say, like, I think we are so lucky in Australia. We work so well, and because my daughter, you know, we experienced the hematologist system as a child. Even most of the adults that we've contacted, like those that are willing, of course, there's confidentiality issues. We can't get hold of the people that we would want to get hold of. We work so well in partnership with the doctors. I remember my daughter, when the first time we traveled, because we were just so scared to travel, until my doctor assured me, our doctor assured me that we are going to prep her. We did transfusions every 3 weeks. We traveled, we went to Zambia, we came to London, we were in Dubai, and she never got sick. But she was calling constantly. We have a contact mobile number, checking on her. I would tell her, she told us where to go to, which shops to go to. Is it Hamleys in London? And got pictures and
toys.
Yeah. We work so well in partnership with the doctors. But my cry is for other countries. As you know, during this pandemic, I found myself to having this intercontinental, if you can call it, global reach, where it's not happening in most of the parts of the world. And this is where I opened my platform to give a voice to any sickle cell warrior, no matter their background, anyone who's, you know, and I take it as face value. If you've told me you've got sickle cell disease, our platform is open. Come and tell your story. We find it very difficult, though, in Australia, for people to come and speak about, you know, and again, I say the time itself will tell. And we've had members in our organization who've taken all these, because we started about 8 years ago, 3 years officially. Just now, this year, this is when they're saying, I'm ready. And I'm like, the doors are open. Anyone is ready. And then with the global reach that we've managed, we've partnered with different organizations and different individuals in different parts, where we have this, what we are calling the Amplify Sickle Cell Voices, where the sole objective is to give a voice to sickle cell warriors. Anyone who is willing to share their story. I have interviewed over 70 sickle cell stakeholders. That includes warriors, mostly caregivers and healthcare providers, just to tell their stories. I've seen there's really power. It's impactful, especially if it comes from people actually living with sickle cell disease. So I agree, definitely, we should be doing that more.
Okay.
Yeah. Well, we are winding up, as I said, almost time. Just one more word of advice to the people that matter most in all this. The sickle cell warriors first, the caregivers and the advocates. What message do they have from you?
I'll just say never give up, and how proud we are of how you're coping.
Thank you so much, Elizabeth. This has been the greatest thing of my career, and I can't wait to travel, and I will find you in London when the borders open, I'm hoping, and I can't wait to see you face to face. But thank you so much for this, and I'll let you rest and have a good afternoon.
Thank you very much, Agnes, and all the very best with all your endeavors. Take care.
Thank you so much. I'll send you my children's book. I've written a children's book. I'm trying now to also reach the children. I've written the first book. Once I get the hard copy, I will post it to you.
Okay. Thank you very much indeed, Agnes, and all the very best. Okay. Take care. Thank you. Okay. Bye-bye. Bye.